Hi, Dr. Bullock here today. I would like to speak with you about meniscus tears and how that may manifest in a patient. So the meniscus, there are actually two menisci in the knee. One is on the medial, so on this right knee model, the inside of the knee, and one is on the lateral aspect of the knee. That's a fibrocartilage structure which people think of as a cushion between the ends of the thigh bone and the shin bone. It actually has much more important properties than just a cushion, although that's one of the functions. It acts as well as stabilizers of the knee, and it does help to offload the articular cartilage, which is the smooth surface of the joint that glides with weight-bearing activities. So it's very integral to the function, the stability, and ultimately the longevity of the knee. So it's really important to identify when there's a problem with the meniscus. Now, meniscus problems can vary from mild wear and tear to significant tears which destabilize it and cause problems with the knee. So sometimes a patient may simply have very mild, vague, non-specific knee pain, and that could be a cause of meniscus issues. And the patient might feel that on what we call the joint line. So between where the thigh bone and the shin bone, the tibia, bend, you could have some discomfort in that area with activities. Especially on the inner meniscus, people sometimes have difficulty when they're sleeping if the other knee rubs against that area because it's a bit inflamed. Those can be managed oftentimes if it's a minor wear and tear with symptomatic management, physical therapy, some anti-inflammatories, on occasion if it's significant, corticosteroid injection, and we have some more modern biologic treatments as well which can help to do that in a safe manner, such as platelet-rich plasma injections, which can help from a more natural way using your body's own cells and signaling factors to help heal. Where orthopedic surgeons become involved is when you have a significant displaced meniscus tear, oftentimes where someone is having what we call mechanical symptoms. They feel like the knee is unstable, they feel as if something is shifting in the knee. In those situations, if it's causing instability, mechanical symptoms, and a patient really cannot do what they need to do, they're having a lot of pain, inflammation, and swelling in the knee, we'll have to do a meniscus surgery. Now, as much as possible, I try to repair a meniscus tear so we can preserve the important function which it serves. And there are different kinds of meniscus tears and different techniques we have to repair it utilizing minimally invasive arthroscopic surgery. I'd like to show you a little bit more detail what the meniscus looks like. So we're going to move on this model, the femur out of the way, and you're looking like a cross-section view at the knee. This is the inner, the medial meniscus, and this is the lateral meniscus. And on this model, I'm going to show you how, for example, it helps provide stability to the knee if the knee wanted to shift, and the ACL is important in preventing that. The meniscus is also serving a function as a bumper effect there. So oftentimes patients who have tears in the back of the meniscus will have some instability issues. For example, just earlier today I did what's called a meniscus root repair, where the patient didn't just tear the substance of the meniscus, but they actually tore the attachment down into the bone in the back. And imagine a chain, it's as strong as the weakest link. So if the link into the back is torn, the meniscus is very slack, and instead of absorbing the forces, it just moves out of the way much more easily, and that can cause pain on the inner side of the knee. So through arthroscopic means, we pass suture through that, and a much more involved meniscus tear, we do a small bony tunnel, and we pull those sutures down through a new bone attachment which we create, and anchor those sutures into the bone here. That now recreates the normal tension on it, and that patient can, with the right rehabilitation and so on, return to pain-free sporting activities, and it can actually really significantly decrease the risk of arthritis in the knee long term. There are simpler meniscus surgeries such as trimming out a flat tear or using sutures. Sometimes if there's a split tear this way, we'll pass a suture on top and a suture below using a very nifty all inside, so only through small poke hole arthroscopic incisions, repair system. And so if you're having knee pain, especially if you feel like your knee's unstable when you get the pain, like a catching sensation in the knee, don't ignore and keep pushing through it, because it's not just the near-term problems you have, but you have the chance to really prevent your knee from becoming problematic in the future and developing arthritis because of poor meniscus function. So reach out to us if you have any concerns or any issues that we can help with. Hopefully we can get you better with minimally invasive techniques, therapy, the right exercise modifications. But if it needs surgery, we're well prepared to take care of simple through to very complex meniscus problems.